are you doing?
Good, how are you?
Good. My name is Bridgette. I'm a student from the University of Detroit Mercy.
Okay.
I'm going to be doing a head-to-toe assessment on you today. Do you have any allergies I should be aware of before we start?
Just seasonal.
Just seasonal allergies? Okay. And are you in any pain today?
No. Well, yeah. My ankle is kind of hurting.
Your ankle's kind of hurting?
Yeah.
When did this start?
About 3 days ago.
3 days ago. And is it radiating anywhere else?
Kind of going down to my toes.
Down to your toes. Is there anything that makes it better or worse?
We don't stand on it, so it feels okay now.
Okay, you don't stand on it. And on a scale of 0 to 10, what would you rate it?
Probably like a 4.
A 4? Okay, do you need any medications right now for that?
No.
Okay. Okay. Can I just check your wristband real quick? Can you state your name and date of birth for me?
Jenny Marks, 5/20/1991.
Perfect. Okay. And do you know where we're at?
We are in the hospital.
We're in the hospital. Do you know why you're here?
Because I'm getting a head-to-toe assessment.
Okay. Patient is alert and oriented times 4. She has good hygiene. Her speech is clear. Her mood is congruent with her affect is congruent with her mood. Okay. And are you ready to get started?
Yeah.
Yeah? Okay. First I'm going to start by assessing your head. The head is normocephalic. I don't see any lesions or bumps. I don't see any parasites. Do you have any pain or tenderness? No? Okay, good. We're going to move on to your face. Her skin is warm to touch. Her skin tone is even. It's clear. I don't see any lesions. I'm going to do a test on you, okay? Wherever I touch you, I'm going to have you close your eyes. Wherever I touch you, I just want you to lift up those places, okay?
Forehead. Left cheek.
Okay.
Chin.
Good. Okay, and now can you smile for me? Good. And puff out your cheeks. All right. Patient's cranial nerves 5 and 7 are intact. Okay. Now I'm going to grab my pen light. I'm going to do a test on you real quick, so just look straight ahead at me. Very good. On the other side. All right, now can you follow my pen light? Just look right at the center. Good. Patient's pupils are round. They're equal, reactive to light, and accommodations. Just going to take a look at your conjunctiva real quick. Can you just look up? All right, it's clear. I don't see any redness or inflammation. No signs of disease or illness. Okay, now I'm going to have you open up your mouth for me. Okay, the mucosa is pink. The tongue looks hydrated. Teeth are evenly spaced. I don't see any sign of the disease in the gums, and I don't see any cavities in the teeth. Can you stick out your tongue and say ah?
Ah.
Good. The uvula is midline. Can you stick your tongue out a little bit more? Tonsils, I'd rate them at a +1. They're present, but they are not inflamed. Good. Now I'm going to check your carotid artery. Good. All right, I rate them at about a +2. They are not bounding, but they are equal. All right, now when I touch it with the bell of my stethoscope, I just need to take a deep breath and hold it for a minute. Okay. Good. Now the other side. All right. I don't hear any bruise. That's a good thing. Now I'm going to keep assessing down your arms. Okay. Patient's skin temperature is warm to touch. Her hair is evenly distributed. Her skin tone is all even. I'm going to test for your brachial arteries here. They're rated normal at a +2, and they're even bilaterally. Now I'm going to test your radial pulse. Good. Even at a +2 and equal bilaterally. Alright, now I'm going to test your capillary refill. Capillary refill is less than 3 seconds. Very good. Okay. Now I'm going to do a grip test on you. So just grab my hands as hard as you can. Good, good. You got good strength and they're equal bilaterally. Okay. Now I am going to listen to your heart. Just breathe normal and relax for me. First I'm going to listen to your aortic heart rate in the second intercostal space on her right hand side. Over here I'm going to hear the S2 sounds. Then I'm going to move over to her pulmonic which is in the second intercostal space on the left-hand side. I'm also going to hear the S2 sounds over here. Then I'm going to move to her herbs in her third intercostal space, tricuspid in the fourth intercostal space, and her mitral in her fifth intercostal space, which is at her mid-clavicular line. And I'm going to listen to her apical heart rate for 60 seconds. Good. I'm going to flip it around and listen with the bell. And I'm not hearing any abnormalities. I don't hear any 3 or 4 S sounds. Good. Now I'm going to listen to your lungs. When I touch you with my stethoscope, I'm just going to have you take a breath for me, okay? Let me know if you feel any dizziness. Okay, breathe in. Okay, lungs are clear. Now I'm just going to test the back side of your lungs. Same thing, just take a breath for me. Good. So one side. And over here. All right. Very good. Lungs are clear. Now I'm going to test you for a little tenderness. Let me know if you have any pain or discomfort, okay? How'd that feel?
No.
No? What about on that side?
No.
No? Okay. Just bend down for me. I'm going to test your spine. Spine is straight. It's midline. Very good. Go ahead and sit back up. And your AP diameter is at a 2 to 1. Good. Okay, now I'm going to test your abdomen. Go ahead and lay down for me. Okay, lean back. Very good. First, I'm going to assess her abdomen, and it is flat. I'm going to check for any lesions or scars. I don't see anything. Now I'm going to listen for some bowel sounds in all 4 of her quadrants. Good. I heard bowel sounds in all 4 quadrants. Okay, now I'm just going to tap on your stomach a little bit. In this quadrant, I'm going to hear tympany. Up here, I'm going to hear some dullness over the liver. Then in this quadrant, it's going to be tympany, except for over the spleen, it's going to be dull. And then in this quadrant, I'm going to hear tympany. Very good. Now I'm just going to press on your stomach a little bit. Let me know if you have any pain or discomfort. Okay. In the lower right-hand quadrant, I'm going to feel the cecum and the appendix. In the upper right-hand corner, I'm going to feel the liver and the gallbladder. In the upper left-hand corner, I'm going to feel the stomach, the spleen, and the pancreas. And then in this quadrant, I am going to feel for her sigmoid colon. The umbilicus is midline. Right above that is her aorta, and I don't feel any bulging. I've got her pulse there, and then right below that is her bladder. Did you have any pain or discomfort with that? Okay. All right, go ahead and sit back up for me. As the patient sat up, I didn't notice any JVD. Very good. Come to the side. All right, now I'm going to go down the legs. Her legs are warm to touch. Even skin tone, even hair distribution. I'm going to feel for your popliteal arteries. And they're even bilaterally, rated at about a +2. Now I'm going to feel your posterior tibialis, and that is also at a +2, and they're even bilaterally. Okay. I'm going to feel your dorsalis pediis. Is that a +2? And it's fair even bilaterally. All right, your capillary refill on your toes is less than 3 seconds. That's very good. Now I'm going to do a little test on the bottom of your feet, okay? How'd that feel?
Yeah.
Okay, patient tested negative for Babinski. Okay, now if you could just stand up for me. Very good. And now walk over to the wall and walk back. Very good. Patient tested positive for the get up and go test. Now if you could just stick your arms straight out and close your eyes. Stand there for about 20 seconds. Okay, 20 seconds later, do you feel any dizziness? No dizziness? Okay, go ahead and close your eyes, or open your eyes, put your arms down. Patient tested positive for the raw birth test. So you can go ahead and take a seat for me, and we're all set with your head to toe assessment.